Hey everyone, great to be here today and give another talk on the patient perspective. And really, I think this is what grounds most of us, medical cannabis and what we see today moving into legalization, is really been decades of advocacy work focused on patients and medical cannabis access. So today I'm going to give you a background on what we're doing as an organization, including some of our policies around access, insurance, taxation, and research. And as Mark mentioned, we'll leave questions to the panel. So first, in terms of background on CFAM and myself. I'm a medical cannabis patient myself. At the age of 14, I was diagnosed with new daily persistent headache, a chronic neurological condition that causes 24/7 constant headaches, migraines, and insomnia. I tried over 40 prescription medications, all other therapies, went to leading neurologists, and there was no answers. I finally turned to medical cannabis and found substantial relief, but really struggled with access. And this is a recurring theme that most patients still experience today. I founded the organization, Canadians for Fair Access to Medical Marijuana, in 2014 as a national nonprofit organization to represent the needs and the rights of medical cannabis patients. Just last week, and it may be a correction in the program, I stepped down in my role as executive director, and we hired a new president and CEO, James O'Hara, who's here today as well. I really think that James will do a great job. He's been with us already 8 months doing our partnerships and strategies, so just wanted to make that clarification, and CFAM is really growing quite substantially. We are over 15,000 members and probably more that since I wrote this deck, but we really come at this from an evidence-informed place, a responsible place, and we have close collaborations with governments and other stakeholders as well. So in terms of our areas of focus from a policy perspective, we have 3 main areas: access, research, and education. And in terms of access, affordability is our #1 focus, as it's really the #1 barrier facing access to medical cannabis. This includes both insurance and taxation, and I'll touch on both today as well. Products and distribution are other key elements of this. In terms of research, we've been advocating for increased funding, reformed licensing to make it easier to conduct research, which we're really happy to see some of those policies come into shape in terms of the Cannabis Act. And in education, we really strive to ensure safe and effective use for medical cannabis, and that means patient education and stakeholder and physician education. So when we look at the patient population, it's really hard to tell what the patient population even is today. I think Hanan's survey did a really good job at getting at some more details at what it is, but the market data that Health Canada tracks is registrations, and we don't know how many registrations on average each patient has, because you can register with multiple producers. So right now, we don't even know how many patients there are in the legal system, so we really need to get a better grasp of that. And CFAM is doing some work in this regard to create a analytics project that will bring some more patient-focused data together in a similar way to Health Canada's been doing. And with that, I don't want to go into it because you did a great job, Hanan, but I think one key point that stuck out of your report and Health Canada's cannabis survey from our perspective is the 97% of respondents found symptom relief and 72% are decreasing other medications. And yes, this is survey data, this is anecdotal evidence, but we can't dismiss the anecdotal evidence. It's so important because we're talking about people. It's not just data, it's actually people and patients and Canadians that we need to take care of. And with that, I'd like to introduce you to a couple of our members. This is Barb. Ironically, she was actually hit by a cannabis-impaired driver while walking. We always stress the importance of safe use around driving and medical cannabis use, but the irony is not lost here. Now, Barb, who never thought she would be using cannabis, is using high doses of CBD oil, and it brings her pain down from a 7 to a 9 to a 2 to a 4. Again, these are the people who are behind the data. And this is why we need to make policies that provide reasonable access to medical cannabis. Similarly, Ronald had a C4 spinal cord injury. He has severe pain. He finds that cannabis oil helps reduce his symptoms, but affordability is a large barrier. He's on disability, and so many other patients we represent are on disability. They're receiving about $1,000 a month, and they can barely afford food and rent with that. let alone medication out of pocket that can exceed $500 a month. So when we talk about access, there's a few elements to it to ensure a robust system that can adequately care for the needs of medical cannabis patients. We think distribution is key. We've been advocating for the inclusion of pharmacies as a distinct medical cannabis retail point for patients to access that, and I'll talk a little bit about why we've taken that position. In terms of supply, we think that medical cannabis, and the task force recommended this as well, that Health Canada ensure that there's supply for medical purposes and monitor that and do what's necessary to ensure that occurs. And one really positive change we're happy to see come in place in C45 is the ability for patients to switch between licensed producers. We've been advocating for this for quite some time. There's supply challenges, there's other reasons why patients may need to switch, just like you may switch with the pharmacy. So this is a great positive step that Health Canada is doing. I think safety has to be at the core of everything we do, and both focus on product safety. We've been involved in the pesticide policies and that type of quality assurance work, as well as patient education and safety as well. Affordability, of course, is a key element, and products as well. We really do think that the limitation on product forms is still hurting patients, as well as the potency limits as well. So why pharmacies? There's 4 main reasons why we support pharmacy distribution. One, and I should note before I go into this, that we support pharmacy distribution, but not at the loss of the current ACMPR framework that provides mail order access as well as personal production. But we think that pharmacies, as an add-on to that system, would offer increased patient safety. It would allow patients to integrate medical cannabis into their overall treatment regime rather than just using it in a silo off to the side. It would provide ease of access. There's thousands of pharmacies across Canada. They're already set up to dispense medications, and it would be very easy for them to add on medical cannabis as an additional item. In terms of education, pharmacists themselves have very high levels of education that could benefit patients, and beyond that, the education that they provide through that to patients is extremely valuable. And professional oversight is something we really value. We think that having a regulated profession, such as pharmacists, deal with dispensing of medical cannabis is valuable to all parties to ensure that there aren't any conflicts or other similar issues. Insurance coverage has been one of the key pillars of CFAM's work. It's been that because affordability is such a challenge. So I'd like to give you an idea of what the current landscape is on insurance coverage, as I'm sure for those at least that practice in clinical practice, that you're going to be getting this question a lot about, I have an authorization for medical cannabis, yet now I can access it, but I can't afford it, so what good is that? So there are some steps, certainly, that physicians and healthcare providers can take to help guide patients through this process. So the current landscape is listed on the left side here. There's some options that already exist that people may not know about, so I think that's the first good step to go through. One of them is a health spending account, or an HSA. Lots of people have these, but they don't realize that medical cannabis can be claimed through it. They're a limited amount, but it really is a good first, easy, and automatic step. If someone has it, they can claim it, and that helps them at least get to start getting some coverage. In terms of formulary coverage, actual drug benefits coverage, there's much more limited coverage in the landscape today. There's currently about 5 plans, and we're seeing many more come online. I think 2018, we actually will see a significant increase in plans in terms of the private space start covering medical cannabis, and we've already seen a couple of major insurers move forward in adding products that plan sponsors can add on to their plans. So we're seeing a lot of movement in this area, which is great. However, no insurers are underwriting the costs yet. So it's not actually traditional benefits coverage. It's really still add-on adjunct therapy, and it comes at an additional cost to every plan sponsor. So beyond the stigma, there are the finances that need to be considered. There is some equipment coverage we're starting to see as well for vaporizer expenses, and beyond that, we're starting to see some plans actually include coverage for physician education and services such as consultations, as they value education very highly within their plans, especially in safety-sensitive workplaces where they want to ensure that their members are going to clinics or groups that can properly consult them and ensure that their safety-sensitive needs are well taken care of. So how do you guide patients through this? The first thing is understanding the plan. The second part is if there's no coverage, to just approach the plan sponsor. So the patient can approach their human resources department generally and seek out the plan administrator. The plan sponsor is typically an employer or a union. It's whoever administers the plan within a private benefits plan. This plan sponsor will essentially have to support the patient's request, as typically no plans cover medical cannabis automatically, and then they'll have to direct their insurer and their benefits providers to start administering this. Luckily, the products that have been offered make this process much easier than has been done in the past few years, but it's not really a difficult process, and we have helped and continue to help many plans through this. And then there's some documentation that's needed, and I think physicians play a key role in this regard. There's letters of support, other documentation, health information, anything you can do to help support an insurance claim is really valuable. And then it takes a while to make a decision. I think it's really frustrating for patients to have patients in the sense that you need a medicine and you expect to get coverage like every other medicine. And that's a fair thing to feel. But the reality is that cannabis is out of the norms, and it does just take some time for employers to simply add this on. And especially in the union context, when we're talking about collective bargaining agreements, we're dealing with plans that have 5-year cycles of contract negotiations or really ingrained issues within their workplace compensation. So this can get quite complex, and I think it's easy to focus on the cannabis, but it's just a complex landscape in general. In terms of public coverage, the really unfortunate thing is that it's much more limited, in even considering how limited private coverage is. Right now, there's pretty much no public coverage that exists in terms of formularies. ODSB is beginning to cover vaporizer expenses in some instances, and we're starting to see increased motor vehicle accident insurance claims, workers' compensation claims, trauma and violent crime victims, so that we're starting to see these kind of more specialty coverage programs for different groups start to cover some expenses, but again, it's nothing across the board, and it's still very individual, especially in workers' compensation. There'll be 2 very similar cases, and they go through at the same time, and they have totally separate decisions. So it requires a lot of legal work, and not everyone can access that, unfortunately. And in terms of taxation, this is the most pressing and urgent issue facing patients, and I think this is where we all need to speak up together collectively and strongly as possible within the next few weeks, essentially. So just to give those a background who don't already know, the government has been proposing taxation in a new way post-legalization. So right now, today, medical cannabis is already subject to HST, GST sales tax, unlike all prescription medications, and we've been advocating against that. That's a serious issue. But I think what adds insult to injury is this new excise or sin tax placed on medical cannabis. We're not talking about a normal tax. We're talking about a sin tax, which is designed to limit consumption. And we're talking about a medicine. We're not talking about something we're trying to limit consumption to. And it may make sense on the recreational side. We don't take a position on that. But when it comes to medical cannabis, I think it's perverse to apply an excise tax. To give you... And what that means is significant. I think, Hanan, again, your survey really demonstrated the difference. Medical cannabis patients are spending, on average, significantly more, and that's what they're spending. That's not what what they really need. 60% of patients, and a number of surveys have found between 50 and 60%, cannot afford their prescribed doses of medical cannabis. So when we look at the spend average, it's not necessarily what patients actually need, it's just what they can afford. And this excise tax and the sales tax combined will add to an average of $1,800 or so per year for a dose of around 2 grams a day. So it's a significant expense, especially when we're talking about someone on disability. CFAM has had a really strong response, and we could use everyone's support if you haven't given it to us already, and if you have, we really appreciate that, and thank you. We launched a campaign called Don't Tax Medicine in November when the government initially launched their proposal. over 16,000 Canadians have written their MPs, and we've been working with a number of Canadians across the country to meet with their MPs and provide assistance to them to do that. Over 12 nonprofits, including some of those speaking today, have joined a coalition supporting our ask of the government to exempt medical cannabis from excise and sales tax. And all opposition parties in the federal government have already spoken out about this. However, the government is not quite listening. They did make one step to exempt CBD or low THC oils, and that's positive, but it is a small part of the market. And it's not necessarily what physicians are prescribing. It should really come back to what physicians are authorizing and what they individually think is best for their treatment, or nurse practitioners, sorry. And with that said, if you do support this, I really encourage you to go to don'ttaxmedicine.ca, get in touch with us. It's really an urgent issue. Now with budget, the next few weeks will be critical. The Budget Implementation Act contains an excise tax provision that solidifies this. However, we're really strongly going to continue advocating as budget implementation goes through the parliamentary process, including appearing before committee, hopefully. And in terms of research, over the past 3 years, CFAM has joined with the Arthritis Society to advocate for $25 million of research funding specific to medical cannabis over 5 years. We also believe that this should go to CIHR or another body to grant it out, and it could be set on the priorities that the Arthritis Society and many familiar faces were at their meeting in, I believe it was 2016, to set research priorities. So that is continued work out of that meeting as well that's still ongoing. And with that, we'll leave questions till later, so yeah.